study that was performed by ViiV that looked at the impact of the COVID pandemic on the long-acting cabotegravir-rilpivirine dosing across the clinical trials. So essentially, these are ongoing trials. There's still ongoing people who are getting cabotegravir-rilpivirine across the different trials. And the question was, in the phase 3 FLARE study and the ATLAS study, was the global COVID pandemic going to not only slow down the enrollment and the continued visits for these patients, but participants, but could there be a concern that people weren't coming in for their long-acting injectables, and so there could be failure in the context of these treatment trials with all the chaos surrounding COVID-19. So essentially, this particular study looked at people who were still active in the phase 2 and 3 CAB and rilpivirine long-acting clinical trials from December 1st, 2019, all the way up to September 2020, so spanning this time of COVID, and they looked at data from 1,744 participants, so 1,744. And they looked specifically at, were people able to come in? Were they able to get their injectable? And very importantly, during these COVID-19 impacted visits, the study investigators provided oral bridges of cabotegravir and rilpivirine at home if they couldn't come in. And so essentially what the bottom line of the study was that despite all of these interruptions from the COVID pandemic, there haven't been any ART interruptions in those 1,700 people in the ongoing ViiV trials. And in fact, most or 93% of those injection visits occurred on time. And then the few people who actually couldn't come in for those COVID-19 visits, they had the oral cabotegravir and rilpivirine as a bridge. And so they were able to continue that oral ARV bridge. And luckily, there were no instances of virologic failure during this time of COVID for those ongoing participants in the trial. So that was very reassuring data from ViiV that, and maybe giving us lessons for thinking about the future, that if we have major things going on in the world that are going to impact our injectables, how do we help inform how to keep on giving people injectables or oral bridges?